What if we have the opposite end of the spectrum, right? Where you have somebody who's been through this for a very long time, has worked in the system for the past 25 years, and sees the cans as just another piece of paperwork that's going to come and go like everything else they've seen in the system. And so the cans is just something we have to get through together. Many times a person who's worked for a long time in the field will say, my approach is eclectic. I use a variety of things that I've found to work over time. And in this scenario, they say, I don't really focus on diagnoses because what I really care about is the relationship. We have to make sure that we're working well together, and the rest takes care of itself. Well, we would use the treatment planning pyramid again to really look critically at what's happened and the extent to which that's really appropriate. One of the things that we've heard from parents when they have an experience like this is that relationships are nice, but relationships are really the starting point. And beyond a relationship, you really need to be provided something that actually changes behaviors, changes moods and emotions, and changes the trajectory of functioning that your child is experiencing, right? So a relationship is a starting point. That's a good sign. You want people to connect, but it can't stop there. We also know from the treatment literature that more accurate diagnoses are associated with better treatment outcomes because parents have told us the reason that is because you're not wasting time on things that aren't actually their core concern. So the treatment literature tells us that the more accurate diagnostic information or more accurate diagnoses are associated with better outcomes. When we talk to parents about why that might be, parents say because we need to be focusing on the things that really matter. So how is it that we might uncover that using the treatment planning pyramid? Well, part of what we would want to make sure that we do as we go through this pyramid is to say, in terms of these goals, has this person really elicited what are the things that matter to the youth and family? So does the long-term goal state what the youth wants to be able to do, not just relationally, but in functional terms? What do they want to do? What do they want to become? And then in the short term, what are the things that they're developing to be able to get there? We'd really want to make sure for somebody who's indicated that they don't focus on diagnoses, we want to make sure that the diagnosis is accurate because it should form the clinical focus of concern, the thing that you spend a fair amount of time addressing to be able to reach your goals, right? This person has said that they tend to be eclectic. You'd want to ask, well, what training do you have in treating this specific diagnosis? And the intervention that you're going to use, how does it relate to this diagnosis? You want them to be able to say clearly what it is that provides this linkage. If they are moving through the cans, again, our concern is that the level of care that gets generated based on somebody just doing a cursory cans is that it might be an underestimate of the true needs that you have, and so you might not be provided the level of supports that you should be provided. And there are some data that indicate that we're seeing fewer cans indicating that people need level 2, which are intensive community supports, than we would be expecting. So there are some data right now in Idaho indicating that people might be moving fairly quickly through these cans and might be missing some things that are important concerns. So you'd want to make sure that where treatment is going to be provided and how much treatment is provided are specified, but really focus on that level of care and how accurate the cans is. You also want to make sure that a person who's focused on the relationship has not only identified what current strengths a youth has, but how they're going to develop new strengths, right? So it might be that they focus on their relationship between the youth and the therapist, but what are they doing that goes beyond the walls of the therapy office? How is it that they're developing strengths that help this youth, your child, move towards their long-term goal, right? So some action steps that you'd want to make sure that you take in this scenario: to review the cans for the accuracy of the ratings, make sure that the level of care feels right, should check in to see what intervention is going to be used. And just to say that I'm eclectic and use a lot of techniques is not an intervention, right? It's your perspective, and it's how you approach care, but it doesn't tell you what the intervention actually is, and you need to know what the intervention is. And you check to see that the diagnosis and the CANS behavioral and emotional needs items truly do match up. And then you'd want to drill down and say, all right, I know you're relationally focused. What strengths and skills are we going to be developing? And how are those the things that my family and my youth really care about and are really going to help us get to our ultimate goals?